Greetings from Texas, oh, also Philadelphia. I'm Mary DeLong, and I am President and CEO of Business and Clinical Management Services, or more fondly referred to as BCMS. Today, we're going to present on compliance mandates. I know that makes you extremely happy, but it's important. We have to have these things on our to-do list as we reopen. It's not going down. So we have some regulators, some agencies that have softened requirements during the pandemic. The Health and Human Services Department, Office of Civil Rights, as it relates to HIPAA and private security, has cut us some slack, so to speak. Basically, what they have done is, as it relates to telehealth and other virtual systems, they're allowing us to use common social media apps. There is a list of those available on both the CDC and OCR's website, if you're not familiar with them. But they also have a list of applications that are public media apps that are not allowed. So it might be good to look at those. They also have stated that we can release PHI to public health and health oversight entities that are working on behalf of individuals during the COVID-19 pandemic. The reason we are using this particular example is because in the past, only covered entities, that's us as providers, could release information under a public health emergency, but this also extends to business associates. Then we have the Office of Inspector General. This relates to anti-kickback statutes, the anti-kickback statute, excuse me, and it relates to co-share waivers in part or in full. As you probably are aware, Medicare and other payers forbid inducement. So you cannot provide money or accept money in exchange for referrals. And normally, if we forgave a copayment or co-insurance, that would be a violation of either Medicare's regulations or the payer's policy. So they are allowing this during the pandemic, and we'll explain that a little bit more later on in the presentation. OSHA has utilized their discretion in using the waiver, and they are waiving certain training, equipment inspections, surveys, requirements, those types of things, because truthfully, there may not be staff there to do those things, or there may not be surveyors available. So that is what they are doing. They are not saying you do not have to comply with standards that would typically be required for healthcare providers and outpatient. So they're basically saying here is you have to make certain, and it needs to be evidence that employees were not and are not exposed to hazards that they would be exposed to because of tasks or duties that they are performing. And they must be educated in advance to perform those activities. That is not waived. So HIPAA during the pandemic, as I mentioned, they are allowing us to use social media that wouldn't, we are social applications, social media applications, I'll get that right, that normally we wouldn't be able to. If you are using one of the non-compliant applications, not the public application, but the social media applications that are allowed but still not compliant, you need to make certain that you start shopping for a compliant one. And the way you can tell it's compliant is that they will agree to sign a business associate agreement and attest that they are in compliance with HIPAA regulations. One thing, just as a tip, it's not required by law, but we highly recommend that you do advise your patients that there is a slight possibility of privacy risk, and also assure them that you're going to use every available encryption and privacy mode so that you can protect their protected health information. The OIG and payers and the waiver of the co-shares. So, of course, to make it simple, all of them have different ways of approaching it and different waiver periods. Medicare will not enforce the anti-kickback statute. I mentioned that a moment ago, the inducement. If a provider chooses to waive a beneficiary's co-share during the pandemic, they will not assume the financial liability of that co-share. So please be aware, if you forgive it, that is money you will not receive. One way or another, Medicare is saying they will not enforce the collection or the waiving of it. However, then let's go to Medicare Advantage plans. You'd think they would be exactly the same. They have stated that they will not enforce plan requirements to collect co-shares from patients during the pandemic, but some are assuming the financial liability and others aren't. And again, there are periods for the waivers. So they may have a termination date that is different from a different Medicare Advantage plan. The commercial payers for the larger part of them are not enforcing plan requirements, and they are allowing you to waive the co-share, and often these payers are assuming the financial liability, but you need to have that verified when you are checking their insurance so that you know whether you have the option to collect, or excuse me, to waive the co-share or not. As I mentioned earlier, OSHA has some discretion as far as enforcement, but one thing they have made absolutely clear is that if you do not demonstrate an effort to comply with OSHA standards, that they will most likely enforce the violation policies. So what does OSHA expect us to do? What standards are we required to have in place? Bloodborne pathogen standards, so we have an exposure control program, very, very important during this pandemic. Hazard communication standards, so this has to deal with, your hazardous substance, that you have the proper safety data sheet, sheets, and labeling is compliant with the new formatting of safety data sheets, and have the pictogram. Personal protective equipment, obviously we have to have the proper equipment, we have to have the proper sizes, types, and those types of things to assure, again, the safety of our employees. Respiratory protection program only applies if the N95 mask is mandated by OSHA. We do not fit in that category, so we do not have to have a respiratory protection program. Believe me, it is very laborious, and it involves a lot of mask fitting, testing, that type of thing. If you choose to have your staff use an N95, again, that's voluntary, so you don't have to have the program. One sidebar, the KN95 and the N95 have the same particulate filtration, so they both filter approximately 95% of all the particles. The difference is the fit of the mask, but both of them do protect the wearer, as not the case for a cloth mask, which is not even considered PPE. It protects the person that is exposed to you if you're wearing a cloth mask, but does not protect you from them, so it doesn't protect the wearer. The medical or surgical masks are a good option as well, but they are not their filtration level is significantly lower than the KN95 or not N95. And you have to comply with the general duty clause. This is what they're looking for. that you have a safe environment for your employees. And yes, we can't be 100% sure that no one will be exposed to COVID-19 in your clinic, but you need to show that you have made diligent efforts to mitigate those exposures. You're going to see this in a lot of federal regulations, that you're going to have the same requirements. So OSHA, HIPAA, a number of the other agency type regulations require an appointed officer. So in this case, it's someone who's going to have oversight and control of the OSHA standards. They are required to have policies and procedures, education and training, compliance monitoring, and compliance enforcement. So think about having those things in place. Those are things that have to be documented. So here's a way to show that processes are in place even if you don't have the policies and procedures. And I'm not going to read through these. I'm sure some of them are going to be jaw-dropping. You're going to say, you got to be kidding. But these truly, if you had a surveyor come in, and let me backtrack a little bit. As most of you are aware, there is a requirement to be in full compliance with OSHA's applicable standards if you are the recipient or an applicant for any of the loans or grants that are available to healthcare providers or businesses during the pandemic. That is a requirement that states from the application process through the loan period, you have to be in compliance. So for the time being, we don't think there's going to be surveyors, but if indeed you had one, and we do know of a couple that have occurred, you want to make certain that you can demonstrate that these processes are in place. And at least if you have the process, you will be making a good faith effort to protect employees and patients. This is another way to demonstrate you got things in place, but you don't have it all documented in policy and procedure format. So you want to look at the processes for source, engineering, and workplace controls. We have created for our clients a table. It is very extensive, and it has a number of things that you can check off as things that you do or have to be performed. The screening of workforce and patients, social distancing and capacity control endeavors. So all of these little things underneath, so what you're doing to minimize exposure in these particular areas or doing these particular tasks. Appropriate PPE, what's available to check off. Do you have gloves of different sizes, different latex or different types of gloves, hand and respiratory etiquette, that is not only something that they could see if they walked in, but what you require, and housekeeping, disinfecting, and sanitation activities. So those should all be in some written form. I mean, you can do bullet points or whatever, but that you have addressed them, you have shared them with the staff, and they know what to expect. So, on to our most frequently asked question in June, and it looks like July is different a little bit, although we're just in the beginning of it, but it looks like there's more of the, oh my gosh, we have an exposure. Oh my gosh, my employee just told me that they tested positive, or a patient did, or whatever. But in June, what we had was, how do I talk to people? What do I say? I don't want to stumble through it. So what we have done is we have created a couple, three actually, best practices for communicating. The first one is communicating with an employee who tested positive. And believe me, they're going to be frightened. They don't know how it's going to impact them. But they also probably feel pretty guilty for exposing others to the virus. So empathy is very, very important. Explains the facility supports the need for quarantine, and that your facility will be in contact with them as it relates to their return. to work. Defer from asking that employee which coworkers or patients they have been in close contact with, unless otherwise, required by local or state departments of health. Because in most cases, the Department of Public Health will do contact tracing. They take that burden off your shoulders. So I wouldn't ask them, who were you near, who do I need to tell, that type of thing. Defer to the Department of Public Health. And explain to them that they will be contacted by the Department of Public Health if they haven't been already. And they will be discussing the next steps. They will talk about contact tracing and work with them on the list, quarantine guidelines, those types of things. So on to the employee who's been exposed to a source individual. And that could be another employee or it could be an active patient. You want to explain to them that the Department of Public Health will be contacting employees that have been in close contact as identified by the source individual. And close contact is less than 6 feet, and for greater than 15 minutes, with or without PPE, with the source individual. And the reason they say with or without PPE is because if one of the individuals is using a cloth mask, that is not considered PPE. And so it basically will be considered without PPE. So they will probably want to know what type of mask, if any, was used. You want to provide your employees with a consistent message, and you want to really give them the use of that message in the event a patient or someone has asked them about the exposure. So limited, keep it simple. Someone in our workplace, you don't have to identify whether it's an employee or patient, but someone in our workplace has tested positive, and that individual is working with the Department of Public Health to identify any other individuals that could have been in close contact with them, and that they will be dealing with any quarantine recommendation, questions about symptomology, testing, and that type of thing. So keep it simple. You want to advise the employees if they are particularly sensitive about potential exposure, that they certainly have the right to contact their personal physician or even the Department of Public Health, because they may need additional assurance because they maybe are living with or in close contact with a high-risk individual. Be sure to listen to their concerns about actual or potential exposure and be ready for or to accommodate time off if necessary. The bottom line is to take away from this particular slide is do not reveal the name of the COVID positive person to the workforce or patients. It is illegal. That is PHI. That is a HIPAA violation that will not be forgiven. And finally, how do we communicate with an active patient who tested positive? Again, all of them, they're frightened. They feel guilty. Most of them probably feel guilty for exposing others to the virus. You want to explain to the patient that the facility realizes that they will have to comply with CDC recommendations for quarantine, and that we will follow those recommendations related to their delayed therapy and their return to therapy. Explain that you will have to contact the Department of Health according to CDC recommendations, and possibly they've been in contact with them already, but explain that the Department of Public Health will take the lead on all contact tracing. You might recommend to the patient to make a mental list or maybe an actual list of people, individuals that they have been in close contact with, because the Department of Public Health is most likely going to ask them that very question. So it might kind of keep them busy while they are preparing for interviews or whatever goes on with the Department of Public Health. And again, reassure people that their safety and health is a priority, and that their therapist or a member of your staff who is qualified will be available to answer therapy-related questions. But those individuals will not be answering any exposure or COVID-19 questions. This is really therapy-related only. So let me turn the program over to Alicia Mahoney, our excuse me, Chief Operating Officer and Chief Marketing Officer. Alicia, away with the program.
All right, thank you, Mary. We're moving on to a quick demo of our compliance program. Earlier in this presentation, Mary mentioned policies and procedures and having things in place. Well, that's exactly what our compliance program does. We do the heavy lifting for you so that you aren't wondering what regulation you have to go and find and read and interpret and write. So what you're seeing here is our client resource portal. This is everything that is going to be covered or mandated by the Department of Health and Human Services. So we're going to cover HIPAA, Medicare, fraud and abuse, non-discrimination, and then also the Department of Labor. That's going to be your OSHA, EEOC, ADA, and this is all specific to outpatient therapy providers. So our program starts by licensing you to a litany of forms. You're going to think of things like intakes, etc., but we're going to take it a much further step. We're going to give you things like your performance reviews or job descriptions or incident reports or annual education. So that's going to all be inside of your forms. We're also going to provide you with state-specific resources. These are typically HR or HIPAA related. So this is going to be here on the portal for you if you are a client of ours. Then you're going to have your own specific silo where you can log in and access your compliance program. The compliance program, again, that we provide is going to have a litany of checklists, and I'm going to walk through those in a second. But really, we're going to give you 6 fully scribed policy manuals. So we're going to have a business office manual. I'm just going to show you that it's fully scribed. All right. We're going to have a clinical operations manual, an environment, health, and safety manual, a HIPAA manual, and then a human resources and employee handbook, as if an attorney did it for you. And again, just to reiterate, this is specific to outpatient therapy providers, so everything's going to be applicable to you. Okay, so the other thing that we're going to have inside of here, besides just your policies and procedures, is going to be a list of all the procedures and modalities so that all you have to do is review these with your staff and have them sign off. These are going to be things that are going to help if there was an incident, be determined not negligence, but again, an incident. So if somebody were doing laser and they burnt the patient and you didn't have a procedure that was written out and an attestation form that was signed, that could be considered negligence. These are going to be layers that we're providing you so you're not having to do them. Now, the way that you make these customized to your specific clinic is actually pretty easy. And excuse the quick scroll up to the top here. So we actually send you an email that looks like this. Welcome aboard. This is our way of saying, here we are, we're your safety raft. We're going to help make sure you have everything in place. And this is going to have 4 steps. So the first step is really the crux of the program. It's going to be 6 questionnaires. If you have multiple locations, we do have 1 additional questionnaire that you would fill out for the other locations so that you have those clinic specific details, because compliance really is at the clinic level. So these questionnaires, you start by coming to this page, and we're going to make sure you have a username and password so that at any time you want to change policies, you can log right back in and go and change the things. Once you're inside of the questionnaire, it looks like this. And really, it's pretty simple. You come in and you date, and you basically date from an effective standpoint. So you want to know, like, a lot of people watching this may not have policies, and so they're like, oh, I'm going to backdate it to 2018. You don't want to do that. An auditor would want to know you have something current. So you could date it literally as of today. And then you're going to start to come through and decipher. If you use an appointment book, you would click here. If you use an electronic scheduling system, you would click here. What we're doing right here is giving you industry standard language. So typically you don't even have to make any modifications. When we want you to make modifications, we're going to say, please customize. Again, for example, inside of this one, you know, we're saying, please make further customizations. So if you did charge for no-shows, you could come in here and just say, okay, we charge for no-shows $50. If it's, you know, a short cancellation, we also charge $50. And then when you're finished with all of the questionnaire, you're going to hit submit. Okay, and you'll know where you are in the questionnaire from this completion bar. Once you have done that, you're going to see you do have your fully written out policies. So you can see, for example, right here, this is your $50 no-show that we just showed you as an example, but we wrote all of this for you. So you're not having to do all that. You're just answering some questions so that we know exactly what to put into the program. So the next step inside of here is going to be our checklist, basically. These are going to be things that you're doing throughout the year. Okay, and so this is going to be located right up here, and we're going to have some simple tools for you. The first is our compliance calendar, and it looks like this. These are going to be us, again, telling you how to do these things throughout the year in bite-sized pieces. So these are things like replacing the battery in the smoke detector, scheduling the fire marshal, maybe a good reminder to do your annual education, or your fire drills. So again, these are going to be all things that we're doing throughout the year to help make sure that you're putting these in place that are beyond just your typical policies and procedures. The last thing that we really include that I want to highlight in our compliance program is something we call HIPPA. HIPPA stands for Seriously Important Practice Alerts, and this is BCMS's way of communicating to our clients. We don't send these out unless it's an industry change or a regulation change or something that's very time sensitive, hence the name. So typically you see between 10 and 15 of these come out a year. We've actually sent out about 23 since the beginning of the pandemic, so we've been pumping out information to our clients. But this is just an example of the type of documents and things that we provide to our clients. Right here you can see we've given a lot of information to that some of you may have seen inside the Insider Circle, where we're giving like employee and patient communication news, or any of your patient decision trees for exposure, or the questionnaires, some of these things. So we're creating these things to help. The other thing inside of HIPAA that we do is we're going to take that regulation language and we're going to make it understandable. So you really shouldn't have to go to a link that CDC has, read it, try to understand what it means, etc. So these are our tools that we again send to you. We actually archive all of our HIPAAs right here on our client portal. So as a client, you'd always be able to come back and review anything we've done in the past, as well as have this search bar for anything that you're looking for specifically. So that's a quick demo on our compliance program. We really hope that you have a great summit, and thank you for your time. Mary, do you have anything else to add?
No, I don't. We are appreciative of the time you're taking to listen to this. And please don't hesitate to call us or contact us. Alicia's information follows in the slides of the handout.
All right. Thank you so much, everyone. Have a great day.
Are you there?